Hello and welcome to The Well. I'm your host, Dr. Brendan Arm, doctor of acupuncture and oriental medicine, Chinese medicine herbalist, and founder director of Lotus Integrative Medicine, Santa Monica, California. There's a wealth of health-related information out there, and I'm joined today by this wonderful group of integrative and holistic medical doctors and practitioners to share some of our favorite wellness tips. Please let me introduce you to Bianca Rodriguez, a holistic psychotherapist, Dr. Heath McAllister, a naturopathic doctor and registered herbalist, and Dr. Rob Krochmal, a medical doctor and a practicing physician who is board certified in family medicine, nutrition, and integrative and holistic medicine. So let's begin. Today's topic is movement as medicine.
I love this topic because as a mental health provider, guys, I was told this from my clinician and, I really took it to heart. And, my clinician told me, you know better. If you have a mental health diagnosis, exercise is not optional. It's part of how you take care of yourself. And if that applies to people who have sort of, kind of a mental health diagnosis, whether you suffer from anxiety or whether you've been diagnosed with depression or bipolar disorder, you got to exercise because there's all these chemicals that the doctors are going to tell you about that get released when you move your body, when you get your heart rate up. And so, guys, I took this to heart, and I know that when I move my body, overall, my baseline of my mood, because I have some anxiety stuff going on, it's just better. It just sort of sets me up for kind of ongoing, not kind of dipping down. Things don't bother me as much. My symptoms sort of stay at bay. And so, yes, the key, though, I think you guys will probably share about this too, is finding something that you enjoy doing, because a lot of us feel like, I think exercise is punishment. I studied to be a classical ballet dancer. Exercise was very regimented to me. So part of my journey has been to change my entire relationship with exercise. And now when I dance, it's really just for fun and for joy. But man, there was a whole journey that went on where I had to take the pressure off because I was no longer a performer. But what can you guys say to kind of like the science of like why movement is medicine and what it does for us?
There's a lot of things that happen when you move. First of all, I would like to say that movement is what we would consider one of the pillars of health. You have sleep, you have diet, you have hydration. Like movement is right up there as important as your diet and your sleep. So some things that happen when you move is obviously your heart rate increases. So your heart is a muscle. You're exercising that muscle. We have massive amounts of cardiovascular disease in this country. We need to keep things toned. You also pump blood out to the periphery. If you pump blood out to the periphery, you oxygenate blood is the vehicle by which you nourish all your tissues with oxygen and nutrients and so forth. So all of your tissues get nourished. You also remove waste products because as you move, you pump the lymphatics of the body, which is a parallel network of fluid that doesn't have the same kind of pressure behind it that your blood flow does. And movement is the way your lymphatics actually drain, which is kind of like the sewer system of the body. You have to keep that moving. If things back up, bad things happen. Some other things, obviously mental health, you get neurotransmitters that are released. In the short term, you get some stress neurotransmitters, but then you get like dopamine and serotonin, which are your feel-good neurotransmitters. So after exercising, that's like, people describe the runner's high. Well, that is the runner's high. If you're getting all these endorphins and neurotransmitters released. And then, I would also say in terms of, so even things like cholesterol, when you're exercising vigorously, you're pumping that blood out to the periphery, and LDLs, which is the low density lipoproteins, those, quote unquote, the bad cholesterol, they get sucked up and used. So like there's so many health impacts from movement. And I always just try and bring it back to like, it is a pillar of health. If you don't move, you will not be healthy. You must have movement. You must have movement of energy and of emotions and of experiences you must process. It's like, it is the flow of life. And when you dam up a river, it becomes stagnant and it gets, if things rot, you must have free flow.
Maybe I
want to second the advice about doing exercise that you really love and that you enjoy and that it shouldn't be punishment. I think that's a really great advice. And I say that to my patients. I also say that you want to be careful about not over exercising as well when you get into it, especially as you're starting to get into your groove. A lot of people can over-exercise and then crash. So as far as the enjoyment of exercise go, my enjoyment is actually riding a bike. And I'm fortunate to live kind of near a state park. And I always get people like saying like, good job, you can make it, as I'm going up the hill, and like, it's going to be so great going down. And I always say like, I'm enjoying the going up part more than the going down. Like I'm the one that's like always holding my brakes going down, not really daredevil in that way.
Let go. It sounds like you might need to learn to let go, Rob.
Yeah, exactly. Yeah, you might not see me next week if I let go too much. But to answer your question, Bianca, about the science behind it, I would, just to add on to what Dr. McAllister was saying, if you think about probably what the number one reason for our health woes as a country can kind of come down to insulin resistance. It's up to 70, 80% of Americans are insulin resistant. It's a bit of a hard concept to understand, but basically, it's what leads to obesity. It's what leads to type 2 diabetes. It can happen 10, 15 years before you end up getting type 2 diabetes. And it leads to, essentially you cannot be in optimal health if you're insulin resistant. And it's a spectrum on the scale of diabetes. So when you think about that,
right back.
we've invested so much of our healthcare dollars in treating diabetes and treating the complications of diabetes, in finding drugs for diabetes. There's so many drugs. There's drugs coming out all the time for diabetes, but essentially none of them actually solve the problem of insulin resistance, with the exception of maybe metformin, which has been around for forever. It's not even one of the new ones. And it, for various reasons that we won't go into today, can do a little bit. But what does do something is exercise. So again, it comes all back around to that topic of exercise. And it's really the best thing and the only thing, besides, of course, nutrition, that can really fundamentally get to the root cause and reverse that problem. So you can look at all the science about how it works, but you can't find a drug that's going to solve those problems. You can only come back to exercise.
And Rob, I would just echo on that so many of the big diseases that we have are what we call diseases of lifestyle. Like, they're called that because it's not like you have a genetic problem or you've got an infection. It's literally how the way you live your life is not sustainable for your body. And it comes down to the fact that we're addicted to high carbohydrate foods or sugars, and we don't move. Like, it's that simple. It's pretty much that simple. There's some nutrient factors involved and so forth, but like if people are moving consistently and eating a lower carbohydrate diet, generally those people don't become diabetic. And if you take a type 2 diabetic, recently diagnosed, and you put them on an exercise program and you put them on a lower carbohydrate diet, you actually like completely reverse diabetes. And I've done it. I'm sure you've done it, Dr. Rob. And it's like, it's not rocket science, but people are not taught in school how to live optimally. Like, we teach about, basic math and basic science. This should be as fundamental as that. Your health classes are really not teaching about optimal health. And when people say, oh, you should avoid sugar, that goes in one ear and out the other. I mean, where sugar is as powerfully addictive as things like heroin and cocaine, you got to really teach people. I feel like the more educated people are in how to run their car, the machine properly, then the more informed we are, the more better we are to make those decisions, not just off the cuff someone telling us, but because we really understand what is health and what is disease, and we get to actually feel what it's like to live in harmony with our body. And exercise is foundational to that.
Let me ask you guys this question. Is it still sort of the same thing? Wasn't it like you want to, raise your heart rate? I don't know 3 times a week for 20 minutes. Is that kind of still the standard? Because I know during COVID, a lot of people have sort of found it hard to get moving. So what's kind of the standard?
Depends who you ask. I mean, there's different, the American College of Rheumatology says you need to get, 30 minutes of exercise 5 days a week, so 150 minutes of exercise, but that's coming from a rheumatologic basis, people that are in pain. So it really depends on, I mean, for me personally, I think that what I recommend is 30 minutes of exercise 5 days a week. So you get 2 days off, but really most of the day, most of your week, you should be moving. And it can be anything from walking to jogging, to cycling, to Pilates, to anything that you like, right? And just like with foods, like oftentimes people don't know if they like a certain food because they haven't tried it. Like, has anyone eaten a kohlrabi? Like, what the heck is a kohlrabi? Go find out. Let's go try it out. Figure out how to cook it. Same thing with exercise. Like maybe, you know, they need to go to some disco dance party like you just went to, Bianca. You know, maybe.
I did it in my house.
Oh, I missed the disco dance party. Oh, I'm gonna have to watch this one afterwards.
The disco ball came down from the ceiling and you just rocked out, and that's great. You know, like you should find foods that you like and types of exercise that you like. You're gonna do it if you like it.
And it's also not sustainable if you don't like it. I think that's the key too. I think people go into stuff super hard. I think that there's so many, you know, programs and all this stuff where it's like, you know, you're supposed to like, you know, jumpstart and do this and do that. And it's not sustainable. And I think people set themselves up for failure.
Yeah, so the boot camps, it's like the yo-yo thing with diets where you like, you go balls to the wall and you're so sore and you're like, oh my God, all these fit people around me, you get discouraged and you stop. You know, that like you have to, like, it takes about 2 weeks of consistent exercise for your body to kind of like get it again. And in that 2-week time period, you have so many people that just drop off.
Mm-hmm. Mm-hmm. I'll chime in a couple of thoughts from a Chinese medicine perspective. And Heath, you know, you or Dr. McAllister, you were kind of touching on this one. I'll just share the perspective of Chinese medicine. The foundation of it has to do with movement. How does energy, how does qi move in your body? If one is tight, you know, and like this, energy stagnates. And when that happens, then there's disease. Anything you can do to help to smooth the flow of qi or help the qi and blood course through the vessels. Typically, movement, exercise, you know, is very helpful just because, as you said, it stretches you out and it releases some of the neurotransmitters in the brain that, you know, the chemicals in the brain that can, you know, help you relax. And anyways, so anything that can help ease the body. And that's what a lot of times what we're doing in acupuncture is putting points in to help the body on some level go back to like a still enough or homeostatic space where the energy can start flowing through the body. And when the energy starts flowing through the body, then the body can heal and recover. That being said, in Chinese medicine, we also break things down a lot by deficiency or excess patterns. You know, if you have a lot of stagnation in your body, by nature, stagnation is a excess pattern. So you need to help to spread it or move it. But the stagnation may be because of an underlying deficiency. So without getting too complicated, I would say it like this. If someone's really run down, you know, exercise is still important, but a lot of rest is really important too. And you would tend to do movement that is, you know, less intense, but more frequent. You know, like maybe every day, but less intense. Whereas someone who's got a lot of stagnation or a lot of excess condition, which, you know, we can always have a conversation about another time, you know, the treatment strategy would be a little different. You'd probably want to do something to help more vigorous to break it up, you know, because if someone's doing a lot of vigorous exercise or excessive exercise and they're really depleted, then they'll get more depleted. So, you know, I guess to summarize it is if you're run down, then slow and steady is a good pace. If you're all uptight and you've got a lot of stuck energy, a lot of stuck emotions, and by the way, the emotions flow through the blood. So if you're stagnant and you're really, you know, uptight, then you can't process your emotions. But if you've got a lot of stagnant energy, then yeah, you need to do, you know, maybe 30, 60 minutes of some type of cardiovascular or yoga practice or biking or something to really get the heart rate going so that, you know, the energy can start to flow. Those are just some thoughts from a Chinese perspective.
It's so individualized. I think that's something that continues to come up here, you know, and our brains are wired to try to look for patterns, to try to make things easy. And, you know, I think it just like really speaks to like kind of honoring where you're at. Cause just hearing what you said, I've had periods in my life where more vigorous exercise, I think, served me. And then I've had periods in my life where, more slow and steady serve me, because we're evolving organisms. I love using that word to describe people, because it really honors the fact that you are shifting and you are changing. So maybe something that you used to do in your 30s is not really what's going to serve you in your 50s, or even when you're going through different emotional phases of your life. Because as we've all acknowledged, right, the relationship between the physical body and the emotional body are intertwined. So, I think just letting people know that this is a journey, and you're changing all the time, and to try to listen to and honor and find practitioners that you trust and that you feel like you can, have on the journey with you to help guide you. But ultimately, it's okay to change, because it's going to keep happening no matter what.
One other thought came up. What time of day, for exercise? I think first thing in the morning. First thing in the morning when the sun is rising, it's a great time to help strengthen your adrenals by getting some exercise. If you're going to do stuff later in the day, I wouldn't do the vigorous, full-on yoga class late in the day. I would do some type of restorative practices later in the day, movement, light walks, stuff like this later. But first thing in the morning, the more vigorous stuff, I would do more first thing in the morning. I don't know.
I would echo that. I would say that if, at the times that I exercise in the morning, I'm like, man, I did something today. Like the rest of the day is like icing on the cake. I took care of like this big physical endeavor, and then everything, and it sets your mood, you're focused, you're oxygenated, you're more relaxed, you're going to have a better day.
Agreed.
Well, that's all the time we have today. If you have a topic you'd like to learn more about, let us know with a comment on social media. And also don't forget to subscribe to our The Well YouTube channel. Thanks for joining us, and please join us next time for more wellness tips. Remember, regardless of where we are, our resources in The Well are limitless.